Mental health is central to every aspect of life, influencing emotional and social well-being, physical health, parenting and family, relationship, work and community, and having a meaningful and satisfying life. World Health Organization says that it is an important asset that needs to be protected and nourished for people and communities in order to thrive. Hello everyone, I'm Erinda Shah, Managing Director of Mental Health First Aid India, and I have the great pleasure to discuss today with my esteemed panelists why integrating mental health with physical health is very critical in our country. Before I go ahead and introduce my panelists here, I'd like to bring some quick data in order to sort of set a tone and all of us understand where is the situation of mental health in our country and whether we need to worry so much and discuss the need for having mental health more and more integrated in our life, not only in the care perspective, access to care to service, but as well in other aspects like financial rights, research, and so on and on. So the content on the statistics would be a bit technical, but I'll promise to make it a bit easier so that and simplify so that all of us have the same understanding. So the first data that I would like to bring is the prevalence of mental illness. You have heard or you would have read often that mental illness is much more closer than we think, isn't it? But what does it mean, much more closer? Statistics says that 1 in 7 people in India will experience a mental illness in lifetime. Isn't that so close? 7 people is just a small family in our country. Now, in workplace, the situation deepened. And the statistics says that every second person at workplace reports either anxiety or depression. They have experienced anxiety or depression due to work-related scenarios. So this is the first statistics that I would like to say is, and I hope we agree that it is pretty close. Either we have seen someone, met someone, or we take care of somebody, or we ourselves may have experienced it. The second data that I'd like to bring is the impact that mental illness had on the individual and the environment around the person. This is called the disease burden. Is usually measured by a statistic called DALY, DALY, which is disability adjusted life in years. I would like to simplify, but what the study says is that in 2017, in India, 197.3 million people were estimated to have a mental illness with a disability adjusted life rate of 2,443 years. I'll pause a bit here because it becomes quite complicated, but I'd like to simplify. What does it mean? It means that in an average of population of 100,000 people who have been diagnosed or lived with mental illness, in India we have lost 2,443 years of healthy life. Okay, and that's big, that's huge. Only in 100,000. So the burden of mental illness would mean that the signs and symptoms of mental illness that the person was experiencing did not allow the person to be productive, to be active, to enjoy life, to contribute. And that is not only for the individual, that becomes much larger. A person, a carer is at home, the less finances at home, the impact goes to the community. We have less people engaged in community or participating, but as well at workplace being less productive and larger in the country. So another data that I'd like to bring is that what is that risk age where mental illness happen the most, that the prevalence is highest? It is somewhere between, statistics says, between 30 to 45, and it's exactly the age when we have the highest level of responsibilities, decision making is at high peak, and the need for growing and thriving is at the highest level. It's when, at this span of life, when we want to have the best well-being, isn't it? Being physically or mentally. The last one to close this bit of statistics and setting the tone is what is called as gap of treatment. So we agree that we have a high prevalence, we now understand that mental illness have a huge impact in our capacity to function. Okay, so what happened with all this need? Do people reach out? What is called gap of treatment means that not accessing services. In simple terms, I can put it like in 10 people who need services, whether they are diagnosed or not, only 2 to 3 people reach out for support. Mm? So it said around 70 to 80% of population does not reach out for support. So these were the statistics, and recognizing all this, I think that we all agree there is a need, the urgent need for making mental health knowledge and access to services very reachable and accessible. Just having hospitals and centers would not be enough, considering that mental illness impact multiple dimensions of our life, from financial and economical to social to psychological to contribution to capacities, legal, and so on. So now allow me to introduce my panelists. And I would like to add here that this talk is streamed as well live in YouTube. You can watch us there, or another time when you can watch at your own comfort. So coming back to my esteemed panelists, I'm sorry I left you waiting a bit, but I wanted to set the tone. I'd like, and I have the great pleasure to introduce and have here with me Dr. Lakshmi Murali, who is a district psychiatrist in DMHP, Government Peripheral Hospital, Chennai. Thank you so much, Doctor, for coming. We have
Thank
been
you, ma'am.
working together since 2018 or 19, where
Yeah.
I was very keen as MHFA India to be sure that we not only inform public that what are the services that governments offer when it comes to mental health, but as well encourage them to access those services. So thank you for being here. I'd like
Thank
to
you.
welcome Dr. Kurinjinathan, Head Department of Mental Wellbeing, NIOT International. Thank you, Doctor, for being here with me. So exciting to explore, and I see the name Department of Mental Wellbeing. So I would like to explore and let know people more about this approach. I have here with me Advocate Satyajit Gupta, an old friend who we have connected in. I remember COVID time. We have had a long call, and it was about MHFA and understanding how to become a mental health procedure. And since then, we have been in touch. Satyajit Gupta is the VP Legal and CSR EXL Daily. And I have here another good friend, Anuruddh Chakraborty, who is HR business partner from Marsh India Insurance Brokers. Thank you very much for being here with me. So, how are you all doing? My very first question. How was your day today? Okay, good. Lovely. Good. Let us start. Dr. Lakshmi, I'd like to start with you. I'd like to start with the
Yeah.
ladies in the room.
Thank you, ma'am. And it's a great pleasure to be here in the Zoom.
Thank you.
And so I would like to share more services provided by the Government of India and also the Government of Tamil Nadu regarding the mental health issues.
Yes.
And in the past 15 years, we have elaborated our program, even in the individual session for the alcohol and also for the wandering mentally ills. We have a separate project, and all the projects is running very successfully in Tamil Nadu. So
Okay.
we all know mental health is a more essential and integral part of the life nowadays. So because our workload, and as the madam had said, the prevalence rate is too high in Tamil Nadu or also in India too. So what are from the government part of side, what are the services we are providing? As we mentioned, the district mental health program gave birth in Tamil Nadu in 1997 in Trichy as a pilot project. They implemented in 1996, and first project is in Trichy. So
Okay.
after the successful outcome of the Trichy project, though they have established in a sequential way, and now at present all the districts having the district mental health program in our Tamil Nadu, and it is successfully running when compared to other states.
I
So
see.
really, I'm so proud in this moment. And regarding the services, mainly the objective of the district mental health program is availability and accessibility of the mental health professional to the unprivileged sector, to all the primary populations. And
Okay.
also we are generating the awareness to the public, and we are activating them to seek help. And also we are giving the treatment. And we are promoting the community participation also. So these is our objectives. In what are the way we are doing the program now? First, we are doing in the phasic manner. In phase 1, we will treat the patient. And second, we will do the rehabilitation. And third is the promotion and prevention. So initially, we will do the IEC and all the awareness activity. Then we will treat the patient and we will rehabilitate. So we are having the HR source. That is the main point here. So government can't afford more people here now. So each district having 2 psychiatrists. That is very less amount. And 1 psychiatrist will look after the administration and also the taluk and headquarters hospital OPD. And the satellite psychiatrist will look after the non-taluk, block, PHC level. The district mental health program, the drugs are available in all the cadre, even in the PHC as a paracetamol.
I see.
So we are visiting the non-taluk, block and PHC monthly once. And taluk and headquarters 15 days once. In headquarters hospital, we are running the OP daily. So these are, apart from the OPD sessions, we are spreading awareness in the schools, colleges, workplace and ground well Anganwadi workers, and we are giving training to the RBSK doctors. That is Rakshaya Shiksha Karyakram, Swastha Karyakram. In this program, it's mainly to the school. These doctors are focusing only to the schools. So we are educating the doctors how to identify the mental health issues or behavioral issues in the children in the schools, and we are educating them. That way, they can refer the cases to us.
Okay, that's great to hear.
Apart, sorry.
No, I'm just saying that's great to hear, because what I understand is that district mental health program purpose and goal is to provide mental health service at community level, and by integrating mental health with general health care. And that's what I'm hearing from you, that along with you visiting,
we are more into the community psychiatry, more into the community participation, and mainly we want to eradicate the stigma from the public, because in initial days, what we usually do, if you're having a psychiatric issue, will approach to the tertiary care. And they'll be little hesitant to take drugs from the tertiary care. And so the poor drug compliance will arise. So in order to avoid that, because the psychiatric patients needs more long days for the medicines and all, to avoid that, we are providing a mental health care services in the PHC level. There we are giving the medicines, and in some occasions we are doing the house visit also. If the patient is not coming for the long time, if any mentally ill patients is not able to come to the hospital now, our social worker will provide the house visit also.
Okay,
and also under the sorry.
Yes, please.
So after that, the DMHP, we started the special projectors are there in the DMHP program. We all know in 2001 we have the airborne tragedy. That is a child death happens in 25 people were mentally ill persons were charged to the death and all. So after that, the government has decided the special project known as Dawa Dua project. In Tamil, they used to say Margam and Maruthuvam. So you can do the prayers and automatically they are giving the treatment also. So you can't, we are not like we are not against the faith or any spiritual activity. If the patients are coming now, we are asking them to do your prayer, and simultaneously we are providing the treatment. So we established mental health care services, DMH services, the Yerwadi Dargah itself. So all the people coming to the Dargah, they will have the faith. We are not at all disturbing. At the same time, they are getting services from the DMHP. So after seeing all the things, the Dargah people were more excited and more happy. They donated 100 acres of land for the construction of the hospital. Now there is a big hospital in the Ramnad district.
Wow, amazing.
So after seeing this project, and you will be knowing the Thuthukudi Puliyandopu church and all. Here also the mentally ill people are coming. So they are also established the DMHP service there. So this project is known as Margam and Maruthuvam. So these are the special projects. And the government has now recently inaugurated 25 de-addiction centers all over the state.
Oh, okay.
And there they are having a separate doctor, separate ward, and all the services we are providing, a detoxification service and also the rehabilitation service. And to the mentally wandering, mentally ill people, they have inaugurated ECRC, Emergency Care Recovery Center, where there are two psychiatrists, three psychiatrists will be there, and social worker will be there, and all the HR will be there. The wandering people will be rescued in the night and they are brought into the hospital. They are giving the treatment, occasional training and rehabilitation and reintegrated with the society and also to the family members. That is successfully running in the Tamil Nadu. And
Thank
also
you.
we are having a halfway homes.
Halfway homes.
Five halfway homes are there where the recovered patients can stay in the home and they can go for a shop. At night they'll come and have the food and have the medicines there. This is a halfway home, 5 halfway home in the district. And also those who are not able to come to the DMHP services or the mental health services, the government has provided 104 calls, 104 helpline. So the online psychologists will be available. So 24/7 they will be in the cabin. You can approach through the call also. And the government has launched October 22 a Telebanas program.
Yes.
Like that is you can call the help to the 104 or the Telebanasu. They will follow the cases periodically after getting the consent. So online consultation is there. And also we are doing those who are going for the self-harm injuries, they will be admitted in the hospital in the emergency center. Thus, after the getting the consent from the patients, we are following the patients for 18 months through the TOY project.
Good.
So so many projects are there in the mental health program. All are successfully running, sir. I'm very happy to share all the things. And for the students' sake, for the students' mental health, they have started the Manam program. That is, they are giving awareness and sensitization how to cope up the problems and the skills in the college life or in the life. They are teaching in the college itself. That is a Manam program. There they are forming a community. They are forming a committee and we are selecting the students and we are educating the students. The students became the ambassadors to all the students. So whenever they are having a help, they can seek the students and that way they can initially they can have a contact, and if they're not able to do so, they will refer to us.
Thank you, Dr. Lakshmi.
So how much of services are there in the
amazing to hear
government?
all those initiatives. I know that those are very specific to Tamil Nadu, and
yes.
I'm not too sure if these, all those are everywhere across India, though. But I am aware that Tamil Nadu.
But one thing I'll like to I forgot and all. For the police, especially for the police person, the police officials have started the Magirchi program. Because in police, they are having more of work pressure, suicides are more high. So the Tamil Nadu government have launched the police well-being training and also the Magirchi program. Initially, they will screen and they will give the awareness to all the police around the state and also to the Chennai. Thereby, after giving the screening and all, they will select the patients and they will come to the Magirchi clinic where I'm the consultant for the clinic. Awesome. So I'm doing the consultation 2 days. That is in the Guru Nanak College, Chennai. So far we have treated 1,500 police persons, and the project is successfully going in the 3rd year.
Thank you, Dr. Lakshmi. It's amazing.
Thank you, ma'am.
Yeah, so I'd like to have a comment here. It is quite an intensive work. Are you there, Dr. Lakshmi?
Sorry, ma'am.
Are you there? I'm just making a
Yeah, I'm here.
Okay, thank you for being
here. I'm here.
Yeah, so it's quite a lot of work, and you explained that 2 days you have one in 15 days you have to be in some center, and another one in 15 days. Where
yes.
There is no DMHP and where there is not such a successful run, because here we are in national level. While you spoke for the success and good activities of how you are integrating in Tamil Nadu, what happened where DMHP, District Mental Health Program, is not there? Who takes care for access to service it?
At present, the DMHP services is all over the state and
Yes.
all over the Tamil Nadu.
Yes.
There
I'm
is
saying
no
in
corner.
country level.
But
In country level.
sorry,
In country level. In other
sir,
states.
almost it is implemented in all the states of India, ma'am. Maybe the services may be delayed, but all the states having the DMHP services, maybe the quality of the services may be decreased due to the manpower and all.
I get it. That's what I
Because, for
want to
example,
ask.
being in Chennai, 2 psychiatrists is not enough to look after the Chennai.
Exactly. So that's what I want
So
to.
that is a lacuna in the DMHP.
Okay. So lack of
So,
professionals, isn't it?
lack of professionals, lack of the HR.
Lack of the HR. So how is this interrupting the integration? So the aim is to integrate
So
mental health
what the
into.
now at present due to the lacunae, the government have some coordination with the NGO. In some ECRC, the NGO is implemented, and in some de-addiction centers, the NGOs are coming in part. With the help
Okay.
of the NGOs, we are running in a smooth way.
Okay. So wanted to ask you, what are the most prevalent mental illness that you are seeing usually?
At present, the more of substance abuse is there, and psychosis is there, and substance abuse. The age is
Reducing.
very low. They started
Reducing.
from the 7th standard, 6th standard. So it is very sad to hear. So the prevalence rate of the substance is too high, but usually they will not report it to the hospitals, ma'am. If you are going to the de-addiction centers, we are visiting the de-addiction centers and MIMR home frequently, 3 months once with the different tabled officer. So now there we can see a small children are in the substance abuse. So prevalence rate of substance is too high nowadays, and also the interpersonal problem and psychosis is little high, and suicidal rates also high due to the depression rate.
I see. Thank you for answering this. I just wanted as well to bring when I do training, when we as MHFA India do go for training, corporates or public, we see that many people, when I'm saying urban going, working in a corporate English speaking, many do not know the existence of district mental health program. Wanted to ask what level of societies usually access the DMHP service? What group of our society usually access those services?
Only from the middle and lower social economics to persons are approaching us.
Only that. Is it that is part of the mission, or where, or people is it lacking because it's not able to reach to everybody and tell them that we are here?
Sorry, ma'am?
So is it because there is lack of resources or lack of capacities to inform even people that are sort of middle class to access the service?
Due
It's
to the
you are a
middle
good
class and
professional.
lack of awareness about the DMHP.
Lack of awareness about the DMHP.
Yes, lack of awareness about the DMHP, because some part it is more fruitful, but some areas it is not able to visible as much as. Maybe still we need more awareness and more publications.
Is it to do only with awareness? And unfortunately, we hear around that usually people have that face value of if you go to the private, you get the best quality of service. Where we stand with this is it that people may know but may not be willing, or
Frankly speaking, in the GH setup, due to the overcrowding, we are not, because being in the psychiatry, now I'm seeing 100 cases today.
100 cases in a day. Wow.
100 cases today in the GH. So the quality may be delayed due to the overcrowding. Maybe the routine patient will give the medicines. The new patients will give elaborate time. My psychologist will assess and they will take. Overcrowding is there.
I do understand. What we do, as I said earlier, we do inform corporates and say, reach out to district mental health program and check the resources there and try how to find out ways of collaboration, because district mental health programs, though limited in resources, are very rich on knowledge, on capacities, as what are the services around. Like you say, you listed a lot of services, so which can
Yes,
be
ma'am.
useful to many groups, either workplaces or not only government one, but as well other groups. Good. So much. Thank you, Dr. Lakshmi. I would actually now like to go to Dr. Purinjinathan, another clinical perspective, but from the private sector. And especially one good day, I find at my doorstep a good envelope from Miyot Hospital where they have put inside a good brochure informing us how to become and informing about Miyot Hospital being the community hospital, and as well informing how to become part of it or to access services. So it was new to see the approach, and now connecting this, Dr. Kunjanathan, with the effort of bringing the service into a more community. What is that Miyot Hospital is doing uh, to come in line with the need of being services much more reachable to public?
Thank you, Anna. And thanks to Dr. Lakshmi. I learned quite a bit about the DMHP program because, I know like I have friends who are in the setup, but today, she gave a very clear, description of all the services that are available. Thank you, Doctor. And also, I'm like curious
Thank
to
you,
ask
sir.
about, like you mentioned about children, whether alcohol or whether other drugs, which is the common substance that's being used by the kids now.
So nowadays, so cannabis is most common, like a chocolate.
Cannabis.
Cannabis is more like a chocolate, and Tidal injection is more, sir. Opioid.
So okay. Thank you, doctor. Okay.
Opioid and Tidal is more, and also the nitravit medicines, tablets.
For the nitrazepams. Okay.
Yes.
Okay.
So
Thank
2
you,
days before also we lost the opioid analgesic. He went into meningoencephalitis, and we
A
lost
bit
the
of
patient.
a real life situation here.
Yeah. Because he had a hepatitis C, hepatitis B, meningoencephalitis. It is a atypical strain. We're not able to treat with the antibiotics. So it's
Thank you,
very
doctor.
tough. More is cannabis like a chocolate, sir. Even from the 14 to 10 years old boy, they are consuming.
Oh.
They're not at all having any guilt over the usage of abstinence, sir.
So you're at the front end, doctor. So
yes.
Yeah, because the society, the family, and also the availability, sir.
Thank you, doctor.
Availability is surplus.
Okay.
Wow.
Even I know where the shops are.
Dr. Lakshmi,
because all the clients used to share where the availability is, where the shop, which petty shop it is, we will get, in what sort of way we can get. So all the patients, they used to share with me.
Okay. So
they will take a class from me.
Okay. Thank you, doctor.
Okay.
And thanks for your question. Regarding our input in community, how we kind of try to integrate. The first thing is like more like a friendly neighborhood approach. So we are entering because we have a lot of corporate buildings nearby, DLF and other thing. I can't tell names, but we approach them. We talk to the HR and go have meetings. Slowly open up discussions about burnouts, anxiety, depression presentation, so that they can be caught much earlier. So that they can have a much more fulfilling career and also prolong their career, because as you know, a lot of people get burnt out and resign and leave. And other than that, we also go to schools, local schools, to build awareness, especially to children and the teachers. As the doctor said, now a lot of children are presenting with behavioral difficulties, and the instinct would be to kind of blame the child and punish the child. So we just go there to kind of just build some awareness to get the context, so that when you're when an adult abuses drugs, we look at it a different way. When children use it, it's a bit more sensitive. So sometimes the parents are unaware. So we have to kind of play it delicately. So the teachers need to pick up signs and symptoms see whether they can help. And also about teenage difficulties, sexual development, complications arising because of that. Now there are a lot of male-female violence, issues around consent, those type of things we go and kind of address it. So it's mainly the corporate and the school setup that we are reaching within the community.
Yes. Okay. So what I see is that the hospital is out of their walls in order to reach to the community. So you cater to a different type of community, so more middle class and above, and with different level of education. In this, just for us, for as well the audience, how is stigma and level and their readiness to talk mental health? Does it differ? Is it less or is it more readiness to talk around it?
It's yes and no, in the sense because like in the poorer section, we also see a lot of people from the poorer section of the society. See, when you're poor, if mental illness affects your work, it has a direct impact. So you seek help so that you get better and you have to get back to work. So they don't worry too much about whether they're seeing a psychiatrist or a neurologist. So they want their problem addressed so then they can get back to work, they can be productive again, and they can look after the family. Whereas in the people with a bit more affluence, there are one group who are quite okay to come and see a psychiatrist. And for some of them, it's even kind of fashionable to kind of, say it's more like New York and London, they can say, I'm on this, I'm on that, very open about it.
There are some people sometimes.
Yeah, self-diagnosed. And there's another group of patients who would say, can you just, sign it as a neurologist?
Okay.
I don't want to take to the pharmacy a prescription from a psychiatrist. I'm more happy to take a prescription from a neurologist. So there is still, the short answer is there is still stigma, but definitely not as much as what it used to be.
Okay, thank you for that. So I noticed that you call your department mental well-being. Usually in hospitals, you have clearly the name psychiatric department. This is under what frame of initiative?
And this is partly about stigma, because we had a lot of discussion before we started, because usually, corporate, they don't start a department per se, and they don't put much money in mental health because there's not that much revenue. Like there's money in procedures, there's money in investigations and inpatient treatment and all those things. Whereas in, psychiatry, it's outpatient clinic, and then the inpatient is not covered by insurance. So I'm happy Anurup is here. Okay. So the insurance don't deal with mental health that much. So that's usually the private investors don't get into mental health, because you don't get the returns for how much you put in. But thankfully, we have a management who are more, ahead of times, and they said, look, if there is some huge need, so we'll create a more updated, very modern setup. And we have been here for 2 years, and thankfully, it's picking up, it's doing well. And here within, we are trying to approach other specialties, because see, the difficulty is also for other specialties. For example, a patient who with anxiety and palpitation, they would go and see a cardiologist because their heart is beating faster and faster. So they go and see a cardiologist. So if the cardiologist sees the patient and does the ECG, echo, everything, and they say everything is okay, normally they would just reassure the patient, everything is fine, you can, all good. So the patients, for the next 2 days, they are okay. Then they start to think, either maybe the doctor missed it, or the machine was not good, or there's a new specialist in a different hospital. So they go to the next hospital, get the cardiology again. So after 3-4 visits, finally one person would say, what, you better see a psychiatrist. Okay. So what we have done is we are working with our own cardiologists. This is about cardiology. You go to neurology, you'll see patients with headache, patients with the vague symptoms. You go to gastro, there are people who want repeated endoscopy done because they have this burning. So there's a lot of, in India, mental health difficulties present with physical symptoms.
Yes.
And the first point of contact is the physicians. And it takes a long while before they are referred to psychiatrists. Because if the doctor tells the patient, you know what, you go and see the psychiatrist after the first time, they'll say, okay, I came for a heart problem. Either you tell me there's a heart problem or not. Are you thinking I am mental? Do you want? So there's still that issues there. Yeah. So we are slowly kind of working with the cardiologist in how best to frame it so that they get, you know, I usually joke with my patients, you know, like I ask them, okay, how much have you spent so far? And it usually varies between like 30,000 to 2 lakhs. And okay, so before they get referred
to the psychiatrist.
So we are working with other physicians to make it a bit more easy to, and we are a bit more accessible. So slowly.
Yeah, I know it's a long journey. It's going to be a long journey, and that set the tone as well, and establish the fact that it doesn't matter what education you have, what group of society you belong to, what gender you are. Stigma around mental health is quite prevalent. There are lots of concerns around it. So with this situation, how can we bring the people to the community care? How can we have people accessing services? Like you said, you are going out and meeting, you are going out and promoting, you are going out and giving awareness. How easy is to come in and form that community sense, that sense of prevention, come much early, be ready to talk about seeing mental health on different perspective. What changes we need to make, especially in the private sector, in order to bring a more community service?
I mean, one is like investing and taking it as seriously as physical health issues and promotions around it. So, I mean, now we have done 2 programs, and even the de-addiction one, now everyone who goes to airport would have seen in the concrete columns, you know, the de-addiction campaign by MHFA.
Yes, there is a sense.
And now and that has generated so much discussion. And we also did one program during COVID time about unlocking the mind. That promotion actually won an award within the ad community. So because there's not that much money that's generated, you don't discuss about it openly, publicly, enough for people to normalize it. So what we're doing is we are kind of trying to if there is advertisement for, you know, oncology and stroke care and emergency MI, similarly we have to kind of put more effort
for mental health,
for people to kind of see it as another physical condition, because that basically we have to, I mean, it's a large task. See, physical health, the body is very easy for people to understand. And mental health, people think there is some soul and it's something to do with me. It's part of the identity. And to shift that into it's a problem of a brain is a bit more easy for people to talk. Like having an epilepsy, having a stroke, there is some chemical imbalance. I mean, it's a very reductionist view. There are also social and psychological factors that contribute to illness. But a little bit more promotion of the biological side would reduce the stigma. So then people would be a bit more easy to come in.
Rightly said. And I went on and I went and found some statistics. The 2023 statistics says that there are 43,486 private hospitals in India. That might not be the fixed number, but this is what we could find. But we couldn't find any data on private community care service. So is private health sector recognizing the need to invest in community care in order to shrink the hospital size and promote a better health outcomes by community care rather than IP care? Is there any trend? Is there any sense of it?
I mean, it's unlikely.
It's unlikely.
Yeah, I mean, I mean, the reality is now there's private equity coming in, and you know, like in hospitals, like how per bed, how much you generate. So we are quite good at addressing once the problem has developed.
Exactly. That's what we are trying to fight.
And prevention is more left to the government and the public. Because, you know, I mean, there are a lot of private hospitals who are under debt, who are not able to run it because it's quite expensive to kind of, you'll see, like people come. So to run a good private sector tightly, making sure that you're doing everything ethically, you're not kind of, and it's the culture, all those things. So that takes a lot of effort. For them to spend extra energy to promote community thing. So you need somebody with maybe big organizations like Tata, Infosys, the big business houses, private houses, they probably could step in rather than, mid-level or small-level private players.
Yeah, thank you for your sincere answer. What I wanted to touch here is the prevention attitude that we have as society. But we clearly need to understand that the days my action towards my health determines my upcoming 10 or 20 years. So health. So it's so important that we collectively promote it. And what I understand is that mainly this remains a duty of government and maybe non-profit sectors. But thank you so much, Dr. Kurinjanathan, for your inputs. I just want to go ahead and I'd like to invite Advocate Satya. Satyajit, are you here with me?
Yep, yeah. I'm here.
Excellent. Thank you. When COVID came, it brought a global focus on mental health issues. Okay, and the scale of awareness around it became very large, and for each and everybody. Why? Because we all felt being threatened financially, insecure, health, didn't know what was going to happen. And there has been always since then a growing concern and a growing demand to see services or to address mental health mainly from person-centered, recovery-oriented, but as well right-based approaches. So coming to the right-based approaches, I just want to use this platform and of course your capacities and your knowledge and experience, where we stand in India when it comes to rights perspective on of people with mental illness. I want to identify this is for people who are diagnosed with mental illness. What are the rights that protects them?
Right. So I think I hope I'm audible, but I'll go on. I think we've always had, I think, a bit of.
Can you be a bit more loud, higher in volume? Yeah.
Are you able to hear me?
I can hear you, but it's a bit low, so that's what. Yeah.
So I will try to speak louder. So I think you brought up a very interesting point. Obviously, the focus on mental health or mental well-being, has sort of magnified in the last few years. And if you look at India's always had as with most of its laws, there's been a fairly colonial approach to them. And if you look at even our Mental Health Care Act, while we have a fairly, I would say, not a very dated act, I think it's from 2017, and the act also provides obviously certain rights, which obviously go far beyond, I think, the earlier Mental Health Act. And on paper, there is, of course, the right to access mental health care and treatment, right to live in a community, right to protection from inhuman treatment, etc. Mm-hmm. But I feel somewhere, and of course, I will sort of take a pause because I know your question was around what rights do people have. But I think it's one thing to have those rights and one thing probably to be able to reinforce, to be able to enjoy those rights. So, as even aside of those rights, there are overall, the Constitution promises rights of right to life, and which includes, which courts have held, which includes the right to have a dignified life, right? So, right to life is not a life at any cost, and of course, other than mental health, or people who are afflicted with mental illnesses, there are. We have seen over the past many years since our constitution has come into play, that people who are on the fringes of society, it actually doesn't mean a minority. It could be a large proportion of people, but people who are not in power or who are seen as weaker have always struggled to enforce these rights. So I would say that when we do read out these rights and when we look at those rights, sometimes they're fairly theoretical, and it's very, very difficult when you step into, let's just say a practical situation. If you are going through if you go through a mental breakdown, you go to hospital. I mean, hospital would probably be more humane, but if you go to a police station or if you're in a public place or even in a workplace, I think it's extremely. I think that stigma is very, very high. People tend to look down upon you, and I think unfortunately uh, things are not really progressed in India. So I'll take a quick pause because I know you may want to segue from that.
Yeah. So thanks a lot for listing all that. And yes, I think not only me, but all of us agree that it's different just to have the law. We have a very good Mental Health Care Act 2017. And as well others by the Constitution definitely is warranted to have a dignified life. But and as well, we need there are other acts as well that you mentioned to assure confidentiality or access to services. Um, what is lacking to make sure that those are applied? That citizens, it doesn't matter whether they are in below poverty or they are middle class or whatever, has access to care. It is warranted that there is quality care and confidentiality is maintained. What can be done in the legal perspective to assure that those are respected and adhered?
Right. So I think, look, from a overall civil society perspective, many things can be done. I know many things are being done, but I think on the legal side, I think it's very important to look at the enforcement of these rights, and we have seen cases of under even the Mental Health Care Act or other cases of individuals who are obviously because of mental illnesses, etc., who have come before courts. Unfortunately, I think the issue has always been that courts have never not taken a very uniform approach. It really sometimes comes down to the judge himself or herself and how compassionate and sometimes even compassion can result in the judge sort of taking a approach which is more protectionist rather than allowing the individual to do something. A lot of cases typically come in, of course, around treatment, but there are a lot of cases which come around property, right? Because obviously, individuals who are sort of going through, some type of mental illness or who are compromised in that manner, do tend to see, do tend to get into situations where they're not able to access funds, access property, etc. So I think one from a legal and from a law enforcement perspective, one thing which can be done definitely is creating more awareness about it, and of course, which would mean training our judges from even the lower and lowest level to deal with these kind of cases much more in a system and in a more uniform fashion. Two is, of course, I think the police, because typically a lot of these cases, whenever these issues come up, the police typically do come onto the scene. Many times, again, they also suffer from. I know in many states, I think earlier Dr. Lakshmi had brought up that there are trainings being done. I think, and in fact, on the obverse, the police and many of the frontline sort of workers, if you may call it, are also actually under risk of mental illnesses, etc. While they are being trained to deal with their own sort of issues, challenges, I think they need to be more compassionate and humane when they're dealing with these kind of situations. And I think overall, I feel that if we are able to address these two links, Erinda, I think this will be extremely helpful because these are typically in a day-to-day situation. On the legal side, the police and the courts are extremely critical, and lots of a lot of the cases where I see people struggling to enforce their rights and to get a get a balance in terms of what they and of course enforce these many rights that are there on our law books. Our struggle is mostly because they're either not able to get a favorable decision in the courts, or of course they have to wait for many years. So I think there are also systemic issues as well. We have very slow judicial process. We have an extremely I would say difficult situation with the police. There are very few policemen. They have to deal with a lot of people. So sometimes, yes, it is also capacity issue, etc. But training and sensitization, I feel, would
important. Okay. Yeah, thank you so much. The last thing that I wanted to mention here is we have the act that protects people with disability, so people who are diagnosed with mental illness. But I'm aware, but from your perspective, is there something that protects people who don't necessarily are diagnosed with a mental illness, but they struggle with their own day-to-day? The idea is that how do we have some acts or laws or what do we have there to prevent, to promote well-being, to encourage prevention, to encourage self-care? For example, you may not be able to do this to enforce to an individual, but definitely you can do something with colleges and universities to have some minimum services and standard, with corporates who have a big say in how they deal with their team, in setting a minimum standard of this must be there, not only to assure that we take care of people who are diagnosed with mental illness, but to assure the rights of people who need to preserve and need to enhance their mental well-being.
Right. So, are you able to hear me?
Yes.
Yeah. So sorry. So I think absolutely. So I think, well, it may not be legal point, but definitely you're right. This is something which, and I think there has been obviously much movement on the space, right? Obviously, with some recent, unfortunate situations a few years, maybe now a year back, was the EY trainee case where she, obviously there was a definite sort of may not be a finding of court, but definitely there was a clear understanding that there was some issue with the work pressure. So I think, absolutely. So I think there is a need to do much more. We have obviously currently there is a process and way to standardize and make uniform our labor laws. As you may have heard, of course, we have 4 labor codes which have been waiting to get implemented. But and of course, those deal with things like occupational safety. Those deal with things like your social security, etc. But I think I think one important factor that probably they miss is just this entire thing of providing a balanced work-life, situation. So I think while of course there are regulations that say what is the number of hours which people can work, but as most of those laws are sort of difficult to implement, etc. for anyone who's not in a factory type situation where they're clocking in and clocking out. But definitely, I think much more from a legislative side could be done. I know that there was a few years back there was a right to disconnect bill which had been brought in, and various other steps taken. But definitely, I think a legal intervention would be great because like you said, and I think there was a conversation which was going on a while back was, of course, large companies like I think some examples were given, could definitely drive a change. And until laws come in, I think that's probably the only hope we have that large companies, whether they're multinationals or even Indian companies like the Tatas, etc. If they drive this change, this will help. Some recent corporate sort of quotes, I don't know, corporate leader quotes saying that you must work 90 hours a week, etc. don't really help. I think somewhere people need to just take a view that, hey, I think everything that or many of the things which some of these people say is taken on, and there's obviously leads to a big debate. But I think there's obviously much more that can be done.
Yeah.
You brought up some good points.
Thank you so much. Yes, it's a big debate, but we still need to keep going, talking about it, because it's really worth changing the situation. Thank you, Satyajit, very much, and I'll definitely speak now to my to my next guest. Anurup, we spoke a lot about prevalence, and here we heard cases of 100 cases in a day for just only one psychiatrist, and the depth of concerns that it brings. So we understood that burden of mental illness is quite high, and burden can be seen not only how much I'm not able to function, but as well financial burden that it brings is the bill that comes along with that on it. So to this burden, I'd like to add the cost to reaching out and accessing services. Today, between 1,000 to 3,000 minimum one session cost for meeting a therapist or a counselor or so on. And I'd like to say that statistics say that in India, out-of-pocket expenditures in health services more than 60%. Okay, so this financial definitely burden, uh, I wanted to bring in into the insurance part. How is insurance trying to sort of ease this financial burden, and what is happening in the insurance fraternity in assuring an integration or leveling between physical illness and mental illness?
Sure. Thank you so much, Erinda, first of all, for having me. And second of all, for asking this very pertinent question. I'm sure many of us are already aware, but I would just like to reiterate that despite IRDAI's 2018 mandate reference to the Mental Health Act
Yeah.
27, mental health at par with physical health, there are many insurance policies which exclude a lot of treatments which are related to mental health. So this is unfortunately the ground reality. But at the same time, I would also want to highlight that there are increasing number of insurance companies that have come up who have started including some of these aspects. While we say that there is an improvement, but I do agree that there is a lot of scope for improvement as well. Now, on this note, Erinda, I remember you talking at the beginning of the session about one in every two employee feel stressed in their everyday life. I would just like to throw a few more statistics to our audiences for their consumption. Um, Due to this, that one in every two employee feels stressed in everyday life, 12 billion working days globally are lost annually to depression and anxiety, and that costs more than 1 trillion US dollars when we really get into the dollar value of it. So that's a lot of productivity loss as well. Only 23% of these unwell employees can actually find mental health care when they need it. So I'll just give you an example. For example, a corporate may have incorporated the group medical policy within their framework. However, there are again limitations which we already talked about in the kind of coverage that that particular group medical policy offers. However, there are corporates who offer something called the Employee Assistance Program, EAP program, under which they can call a counselor and seek help. Now, you'll be amazed to know that a lot of people, employees, do not even know that they have an EAP program sponsored by the company. They do not have toll-free numbers saved on their mobile devices through which they can. Moreover, even if they have, there is again a stigma. If my employer comes to know, what if someone tells them, what if I lose the job? So yeah, multiple factors around it, but at the same time, there are gaps, but the gaps are narrowing down. But at the same time, I would just want to highlight that they should narrow down at a little more faster rate than
So, Anurup, help us, individuals, and thanks for this, to individuals and corporate. What should they look when they have an insurance conversation and they have to buy an insurance? What should they look to assure that mental illness is covered and everything around it?
Absolutely. Very, very fair question, Erinda. So I would like to divide it into two parts. One, as an individual, when you buy a health insurance cover, what are the things that you should see? And second, if you are a corporate employee, unfortunately, you do not have a right to really uh,
Look at
uh,
the package.
be a part of that conversation
Yes.
where you talk about the inclusions. However, the HRs in your organization have that right. Have a seat on that table,
Mhm.
and I would want to appeal to the HR fraternity out here through this program that. Uh, I know that there is an increasing cost when you include mental well-being in your insurance program, but data says that for every $1 that you spend, there's a return of around $4 that
Mhm.
you get. And I'm again referring to one of the reports that Marsh McLellan has very recently
Mhm.
published. I would want to encourage everyone to download this report as well. They will get a lot of insights. It's called the Rise Up for a Better Tomorrow
Mhm.
Mental Health for 2025. So you can download your copy. It's absolutely free. And in case you need any assistance in terms of reaching out to an expert who can guide you on how you get this coverage in your corporate health package. Marsh is the biggest insurance broker in the world. We can definitely help you in doing that as well.
Yeah, thank you so much for referring to the report, and definitely we will try as well share with clients that we work and as well in our social media so people can have access and HRs especially on that. I mean, Marsh is as well client of MHFA India, and we have trained mental health first aiders. But I see that there is as well another angle that we cooperate together where Marsh is working in reducing the risk of their clients when it comes to mental health. So what is exactly that Marsh guides their clients, and do come and suggest to their clients, take MHFA, take mental health first training for your corporate as another action towards reducing the risk to it. Is this the approach towards that prevention and early intervention and empowerment of people, and having people not waiting till they become ill and then we start claims and other concerns?
Absolutely. You're absolutely right, Erinda. Uh, 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 I have seen an increasing focus of prevention. And as the very well-known verse says that prevention is better than cure, which it's absolutely true, not just in the case of mental health, but also in the case of physical health. And in terms of physical health, we say that, hey, why don't you go and exercise so that you are fit and you don't injure yourself and things like that. But even in terms of mental health, uh, I personally feel that there is lot of need to sensitize people. See, for example, okay, I bruise my hand. I go and walk up to my parents and say, "Hey, I bruised my hand." What will they do? They'll come with Dettol and Band-Aid, and they would patch me up. Hey, and they'll say, "Hey, you take rest, okay? You don't need to do anything, right?" But what if I just walk up to my manager and say, "Hey, you know what? I feel stressed. I don't feel like working today. Uh, I don't know. I don't know what it is, but I don't know, but I feel stressed." What would my manager say? Will they do some similar sort of patchwork and tell me, "Hey, you know what? You take rest." In many situations, Erinda, unfortunately, uh, the reaction is very different. Now, here comes the role of awareness and
Mhm.
being present that mental wellness is something which should be taken care of. And that is where I think MHFA plays a very, very important role in sensitizing. And it's not just MHFA, but there are a lot of other programs as well. And I would like to highlight that it's a lot of it is also available now in in today's internet age. And you definitely walk up to the internet and read it. But at the same time, being a mental health first aid, I would just want to open this up to everyone, and I'm sure every mental health first aider would be happy to volunteer. In case any one of you have any issue, and you can confide in someone in who you can talk to, and if in any case, if that is me, please feel free to come up.
Thank you. Thank you for offering yourself. Nevertheless, despite, I mean, as you said, data said that says that only 1% of claims, insurance claims, are from mental health, for mental illness. So there's a lot of a long journey to go ahead. Thank you so much, Anurup, for bringing your perspective and maybe as well giving and sharing information that would be useful for the people. So one last point from each of you. How can people integrate preventive actions in mental health? Because my understanding is that integrating mental health and physical health is not just the duty of governments. It's not enough just to have a community center there, and that is good and helpful. It's not just enough to have multiple only doctors around or only healthcare, but multiple aspects from insurance to rights to research to other things. And I think that people are the central change of this, the attitudes and behaviors, and that's what I noticed throughout the entire conversation. Awareness, sensitization, education was the most repeated words, and is like a call that we can't change this alone. We need everybody to line up and do their own bit in changing the situation in more prevention rather than treatment. One or two things. What can people do to integrate prevention? Dr. Kurinjinathan? You are mute. You're mute, doctor. Yes.
So the main thing, what I observe, maybe it's the kind of clientele I'm seeing, is the awareness of the market economy and its impact on your well-being. Because, see, you're measured by productivity and it's non-stop. Okay, so you have WhatsApp, you have internet, you have email, everything. So unless you are very aware of what's happening around you, because there's constant demand. There are new phones coming up, kids need new shoes, you need a newer model car, you have a next house, all those things. So this constant drive, you see advertisements everywhere, and you have to understand the psychology of advertisements. You have to probably teach from childhood about how the human brain evolves and develops and desires and fears. Now with the social media, the comparison starts much earlier. So this constant drive, it is very tiring for people.
Yeah, that's true.
So unless you're aware of it, and you have to be part of the rat race, but how do you enjoy the rat race is the key.
Thank you. Thank you. Dr. Lakshmi? What people can integrate in their life? I mean, what can they do to...
As Isa said, and also you also mentioned awareness from the individual level. Okay. So we can spread awareness even from the school itself, through the teachers, because teachers are the more vulnerable weapon. So they can educate life skills to the students, and also the mental health well-being, and when you became sick, whom to seek help. So all the awareness should be started from the beginning of the route.
Great, thank you.
And also we have to concentrate mainly on the parenting style. Even though the psychiatric and behavioral issues mainly to the psychosocial environment, but main parenting is a main first point, because I have noticed. So you should be from the gross level, Even from the schools, teachers, you should have some classes, and individual person awareness should be there about the mental illness and the seeking of help from the professionals.
Thank you, Dr.
Maybe
Lakshmi.
even though they have they have diagnosed the mental illness, they are not ready to seek the help from the professionals. They think that it is the dignity they lost the dignity, or somebody where they say feel. Even I went to the one of the corporate to give a lecture and all. Even they're not able to maintain the work-life balance. So interpersonal relationship, the wife is
Are
too
disturbed.
difficult. So they are broken the family. So this person is very stressful. So even you have to give a more awareness from the individual person.
Yes. Thank you, Dr. Lakshmi.
That is more important. Thank you, ma'am.
Thank you. Satyajit, final note.
Sure. No, I think absolutely. I think the points which which have been made with other panelists have been fantastic. I would say, look, while of course we talk of what can we do to others and what can we teach others, definitely, yeah, sure. I think it's important to teach our children, important to pass this along to others. Very important, I think, in our own lives to bring in self-care. I think it's even, I feel even as first aiders, etc. Sometimes we are not able to do it with ourselves. So the ability to say no, the ability to say that, look, that's it. I'm completely full. I'm overloaded. The ability to sort of just sometimes stand still and just pause and think about things. So I think sometimes, I mean, these are things which we can all do. We can bring into our own lives. If we do it, I hope with that some change will come through.
Yeah, thank you so much. Anurup, final?
Absolutely. So I would like to take a cue from what Dr. Kurinjanathan said. In this fast-paced world, there's a lot of things coming in and you need to enjoy while you live this rat race. But it's very important that you prioritize what you want and not. It's important to say no and let things go as well. And very important for each and every one of us is to form very deep relationships. I personally think that we have lost the art of forming deep relationships with each other and self-care, because this self-care and deep relationship forming will be the safety net for each and every one of us in case we go into a downward spiral. And that would be my suggestion. And from a corporate perspective, I would suggest that corporate should should concentrate on creating an environment of psychological safety where people feel safe to be themselves. And there are multiple ways to do it, but again, in short, that's
Thank you so much. I would remain with awareness and self-care, especially self-care as that small step that each of us do. And we go in a long run. Definitely the conversation around importance of integrating mental health and physical health remains open. We did as much as possible with our own expertise here. Thank you so much to each and everybody that was with us. Thank you to my panelists here. Thank you for your insights. And take care of yourself and have a great evening. Thank you, Satyajit, Dr. Lakshmi, Dr. Kurinjanathan, and Anurup. Have a great time. Thank you, everybody, for watching us. Take care of yourself.
Thank you, ma'am, and thank you all.
Thank you so much. Have a good evening. Bye-bye.